Good morning to all of you from SSM MSRC, Davangere Pathology Department. Me and Dr. Nazma were just seeing a slide. Please help us to know what it is.
Yes, actually.
Let me show you the microscopy of what we were seeing. Okay.
So this was actually the case of 56-year female. She had a history of giddiness and she had died. So we had got her heart specimen.
Let us not talk about all the other findings which were there in the heart, and we are seeing the slight disturbance here. Okay. Microscopic appearance. This is under low power. So I'm moving the field. You can see how the muscle fibers are separated, mild inflammation.
And there is some difference in the
Okay, I'm stopping it here. Yeah. Slightly higher magnification. You can go back here and then observe what it is. Yes, yeah, this is what.
And also there are some normal myocytes, but there are some different.
Let us see under high power again. What made us stop the video here?
There is something like a band-like structure.
Let me pause here. Very nicely, we can make out the cross striations of the myocardial fibers, and this is what made us stop here.
Stop here, exactly.
This is the observation. Yes. Just 1 minute. We are seeing the microscopy. Yeah. I think that should be fine, right?
Yes, ma'am.
We'll see some more pictures.
So this is a similar picture.
Yeah, this is still. We were seeing the video, and then
you can see beautiful myofibers.
Very nice striations. You know, so this is what art pages. They know what stain to use and all that. You ask them anytime, they say PTH. They're not there here now. Yeah, for the striations. So the important feature is this, which was catchy. Yes, we keep seeing it, but still, no, we thought let us talk about it. Yeah, we'll move on to the next picture. Yeah, this is what Nazma has marked for identification. Everybody would have identified by this time. The third picture, very clear, a thin section. Muscle fibers are separated. So let us see the zoom and see.
Yeah. You can see a lipochrome pigment also here.
Yes. Okay. The last picture, I think.
Any clues you have or something running in the mind?
Yes, as you already said there. This is really nice.
Very good finding. And this is actually our case. It's not any picture taken from a Google.
Yeah, this is from that 55-year-old female who died. There is a history of,
giddiness.
And
there was a fall.
She fell down, and then they brought her to the hospital. And by the time she came to the hospital, she was found dead. So that's why they insisted on the autopsy. This came from forensic medicine to us, forensic department. Okay, fine. By this time, all of us know what it is. Very classical finding. That's why we said uncover. So discover or spot what is this. Yeah.
So this is actually.
I'll go to slideshow.
Yes.
You can Let's talk about it. A very nice reference.
Yeah, this is actually a contraction band necrosis, and it is some information has been extracted from this article. It's a very beautiful article. We can go through this.
Yeah, diagnosis of myocardial infarction at autopsy. AECVP reappraisal in the light of the current clinical classification. So what are we taking from this article is only the microscopic
features.
finding. Okay.
So central band necrosis is actually an ischemia and
Contraction band
change.
necrosis. Yeah.
Contraction band necrosis. So this is actually an ischemic change, and it is a type of a necrosis of myocytes, which is the earliest site of a myocardial injury, which arises 10 minutes after the onset of ischemia and reperfusion. And it is characterized by the occurrence of thick eosinophilic bands in the cytoplasm of cardiomyocytes due to the clustering of hypercontracted contractile proteins.
Yeah, this is what we saw. Now we kept showing the thick eosinophilic bands of cytoplasm in the myocytes, cardiac myocytes or cardiomyocytes.
I hope you are clear with that picture. It is more clear. And after restoration of flow,
this is what our the article has given the picture. But you could see the pictures which we showed from the case that the much were better. Yeah.
So they are coming to its pathology, like after restoration of a flow or reperfusion, dying cardiomyocytes with ischemically damaged cell membranes are exposed to high serum calcium concentrations, leading to massive calcium influx followed by irreversible hypercontraction.
So there is irreversible hypercontraction.
Yes.
That is what we are seeing so well seen even in microscopy. I mean, the light microscopy, HND stain sections.
Yeah, that's why we are seeing those bands. It is important to note that contraction bands are not a feature of ischemic infarction alone, but they occur frequently in the periphery or the border zones of ischemic infarction, which is due to microvascular collateral perfusion from adjacent vital myocardium. So caution should be taken with the interpretation of the presence of contraction band necrosis, since they can also be observed after CPR, including defibrillation and other trauma.
So there are so many causes for contraction band necrosis. We just put the slide here for observation because microscopy was so nice. And now we have got to know the causes of CBN.
Yeah. So then not specifically related to the percutaneous intervention, PCI, but clearly of importance in the forensic setting. They mean to say that it is not specifically related to some infarction. Contraction band necrosis has been observed in situation of catecholamine excess, drowning, drug abuse, cobalt poisoning, starvation, free radical injuries, brain death, and intracerebral hemorrhage. Also remember that contraction band necrosis is accompanied by microvascular injury leading to endothelial swelling, microvascular obstruction, and interstitial hemorrhages. So this is what we wanted to tell you. And
can we summarize the causes of whenever we see such contraction by necrosis? So what are all the possibilities? So what does this microscopic features tell us about? Recent
ischemic infarction. It is actually the most common cause, they say.
Yes.
And then we can see such changes in the after CPR and defibrillation also. And also in the state of catecholamine excess, and in the cases of drowning, drug abuse, cobalt poisoning also, and also in starvation. And other causes of free radical injuries can also cause contraction band necrosis, and other causes are less common causes are brain death and intracerebral hemorrhage.
Yeah. So this patient, we're not discussing all the other features that this case had, but we received only heart and a part of the lungs of both the pieces of, I should say, both the lungs were very characteristic. They showed malignancy. Remember?
Malignancy, yes.
Yes. And this patient, this case had intracerebral hemorrhage intracerebral hemorrhage, pontine hemorrhages, and all that. So our point of discussion was only a microscopic finding, histological finding in cardia, that is in the myocardium, in HND stain sections, that is the contraction band necrosis. Yes, shown. So now we have read about the description of it. See, there's a contraction band necrosis.
I hope our pictures are more clear than the articles. Beautiful.
I just
glands.
zoom this. We can observe. Yes. So contraction band necrosis, just one histological finding, which can give a clue to the underlying
Cause.
cause.
So that's why we said it uncovered the histology of the myocardiocytes.
Yes.
I hope
Thank
you
you.
enjoyed the case and also the pictures, which was our own case. So have a good day.
Thank you. Thank you, Nazma.
Thank you.